All right. Hello, everyone. Thank you. I'm Angie Lindsey, and I am very happy to be here with you today. First of all, I want to say that although I work for Fresenius Kabi, I'm not making any claims about the safety or efficacy of any of our products today, but I am excited to talk to you about labeling and the manufacturer's perspective. First of all, there are many opinions, both for and against using color on medication labels. And what we're going to discuss today are some of the considerations for these choices and what manufacturers are looking at when we make these choices. And also why lookalike errors continue to persist. So let's explore together what we can do. So here's a basic picture of a vial, and you've all seen this many times, but I just want to go over the places where manufacturers can interject color thoughtfully. The cap, the seal, and the label. The cap is meant to be a cover for the stopper. So from a manufacturer perspective, anything on the vial that is within the fluid path requires extractable leachable studies in order to make changes. And those studies are submitted to the FDA prior to our file being approved for the drug. The good news is the cap is covering the stopper. So the stopper is what is subject to these extractable leachable studies, which take time and resources. But if we were to make a change to the cap, and let's just say make a color change, choose a different color, that is considered an annual reportable to our FDA file. So we're just notifying the FDA that we are making that change. So it's fairly simple. The label, if we make changes to the label, I think Savan covered that earlier today, that is somewhere in the middle. That is not as extensive as extractable leachable studies, but it does require FDA approval. So we would submit that to the FDA for their approval of any label changes, which would include changing color to the label. All right. So today, label, cap, colors for the generic injectable drugs specifically are hugely variable, and they provide no consistency, really, for you as clinicians. Generic manufacturers either use the reference list drug and follow what the branded drug had for colors, or generic manufacturers can also select whatever color they want in their file. And as long as the FDA is approving that, there are no standards or guidance on color for the most part. We'll talk about that. So what I'd like for us to think about in this presentation is, could standardizing some color add another layer of safety to our system? So let's find out. So you've seen a lot of these pictures. This is from the APSF gallery of lookalikes. The first picture on the left is lidocaine and bupivacaine. They look very similar. The author that submitted this picture said that they attribute the color of a red cap to epinephrine being added to the vial. And in both of these cases, that is not true. So this attribute is not the case. The middle picture are 4 vials with very similar cap colors. The labels look a little bit different, but obviously glycopyrrolate, ondansetron, concentrate, phenylephrine, and metoclopramide are commonly stored in your anesthesia trays. And if they are stored with the cap up, this is very problematic, and which is why ISMP recommends storing these vials with the label up. The right picture, a lot of the same medications plus more. You also have concentrate dexmedetomidine. So if any of these products are mixed up, because they do look very similar, and a lot of these labels in the blue picture look very similar, that would be problematic. And I want to draw your attention to glycopyrrolate. So it's the first vial in the middle picture. It is the third vial in the picture on the right. So if you had to guess how many manufacturers, generic manufacturers or generic labels are out there for a glycopyrrolate vial, does anybody want to throw out a number? How many companies like Fresenius Kabi are making glycopyrrolate? Anyone?
30, 20.
Very close, 18. There are 18 companies like Fresenius Kabi that are making glycopyrrolate vials today, and that's manufactured vials. Now, 2017, I looked this up. There were only 4 manufacturers making glycopyrrolate vials. When I started with Fresenius Kabi 12 and a half years ago, we had 60 generic manufacturer competitors within our addressable market. Today, we have 123. So you think about all of those companies coming into the market, bringing vials, that's where this variability is coming. We do not have specific standards that we're following, when we're selecting colors for our products. Just earlier this year, another manufacturer was approved for a line of bupivacaine vials. They picked a different color for every strength and concentration, including Barbie pink is one of the cap colors. So this variation is continuing as more manufacturers come to the market. Situations that prompt change exacerbate risk. So when you think about all of the situations that may result in a change in which manufacturer vial your hospital or your institution is using, drug shortages are a big one. There's a lot of switches that occur with drug shortages, and also contract changes. They happen a lot where your hospital may be changing contract, because when you have all of these manufacturers that are coming to the market, 18 glycopyrrolate vial manufacturers, guess what? They all want on your contracts. So that's what's causing a lot of these changes. So when you think about, and actually I'm going to go back, when you think about that, how should we communicate changes to you, the end user? How should your pharmacy be communicating to that? So if your hospital is bringing in a different manufacturer of a product that looks significantly different, how should they alert you to that? That's a question to think about. So here's one more example, ISMP medication safety alert. So in 2022, there was an article, Scan Before You Flush. So a heparin flush syringe and a 10% calcium chloride syringe, both with bright yellow labels, they both look very similar, right? So this was published. So the manufacturer of the calcium chloride syringe said, okay, I'm going to change the color of the label so it's differentiated, and went with the dark brown. Well, guess what? In 2024, another article is published, another safety alert, that a healthcare provider during a pediatric code was delayed in finding that syringe because they were looking for the yellow syringe that they've been using for years and years. So again, that association resulted in a delayed treatment. So as we think about the guidance that manufacturers are following for labels, Sivan did a wonderful job covering this earlier today. So, but we think about this, and generally, the FDA generally recommends avoiding color coding in most instances, which is why you see so much variability in labels today. But we do implement tall man lettering in our labels. We try to keep the label decluttered. So there is an opportunity, I think, moving forward. We are, as manufacturers, starting to put 2D barcodes on labels, which the 2D barcode offers more information for you as a clinician and for pharmacy. It offers the lot number and expiry within that scan. So a linear barcode is just giving you the NDC and the drug information. So if right now we're adding the 2D barcode to the label, so we have a linear barcode, a 2D barcode, and in some cases, even an RFID. So maybe someday we can eliminate that big linear barcode and just use the 2D, again, to declutter the label so that your eyes will go directly to the name of the drug. Regulatory guidance on caps, very simple. Black for potassium chloride. And then we've talked already about neuromuscular blockers today, but cautionary statements are on the cap of neuromuscular blockers because it's there to prevent an imminent life-threatening situation. So what you'll see, generic manufacturers of neuromuscular blockers have paralyzing agent on the cap. But otherwise, there are no guidelines that we're following for cap colors and cap selection. So we believe that manufacturers should be considering how these drugs are being stored and how they are being dispensed, how they are being used as we're making those decisions for color and how to bring color into the label. So because of this, Fresenius Kabi did a project internally. So, and I have some of the members of that team that conducted the project are here today. But we did an ASTM color project and using the standards that Rick talked about previously. But we assessed the use of ASTM color specifications for all of our drugs that fall within the drug class of the ASTM colors for anesthesia. And we also created a portal where we could easily see the labels and the cap colors of all of our products. Now we have over 650 SKUs in total, but we're starting with our anesthesia products. And then we also collected insights from external and internal subject matter experts, and it's been a really good process. So what we found at Fresenius Kabi, so out of all of our drugs that we supply, we're a generic injectable company. 229 SKUs were eligible within the drug classes identified by this ASTM project. And only 13% were compliant with the ASTM colors today, which makes sense if you think about it, because for the last over a decade that Fresenius Kabi has been bringing these drugs to the market, we have not been thinking about the color and making any choices based on ASTM guidelines. So now we're starting to think about this. But 13% were compliant with the cap color and 14% had some of the color of ASTM in the label. So again, this was very interesting information for us to look at. So are there certain classes of drugs that we should be intentional about making these decisions, and what should we do about it? So here's just some examples. So we could put color around the secondary information, color around the primary information. We could be interjecting color on the cap. And here are some of the products that maybe we should be looking at, like narcotics, vasopressors, local anesthetics, or muscle relaxers. So I will conclude with the insights and recommendations. So one thing that we realized in doing this project, that Fresenius Kabi could not do this alone. I mentioned there's 123 other companies that are within our addressable market of generic injectable drugs. So if color were to be meaningful for you as clinicians, we would all need to do something together. But what we can focus on is implementing auto-identification technologies where possible, such as RFID, 2D data matrix, computer vision. We can dispense ready-to-administer drugs and make more of those for you, make the syringes that you need for your practice. We can analyze those high-risk situations like the tranexamic acid that has already been talked about. Fresenius Kabi made a decision this year to discontinue our tranexamic acid vial. There's 13 other manufacturers in the market that make it. We'll let them make the vial. We're going to focus on a premix bag. And then prioritize drug classes where errors could be lethal or have more severe outcomes. So a quick poll, and this is my last slide. All right, would adopting ASTM color standards for vials and prefilled syringes be helpful for you? And this is for all of us in manufacturing. Are you waiting for the result? There we go.